late March 2017, experts from the World Health Organization, WHO, and other international organizations, as well as other countries, examined Finland's preparedness to respond to extensive health threats. Such health threats include an influenza pandemic, antimicrobial resistance, or other local epidemics that threaten to spread globally. The Joint External Evaluation, the JEE, is a voluntary, multi-sectoral, peer-to-peer evaluation assessment. It follows a standardized process that aligns to the principles of transparency, multi-sectoral engagement, and public reporting. In Finland, the national coordination of the JEE was conducted under the authority of the Security Committee, a broad-based cooperation platform that assists the government and ministries in issues of comprehensive security of the society.
We are quite well advanced in our way of how we join our forces and how we get different actors and different offices, different authorities together to think about and improve our preparedness. But of course, lots of work still has to be done, and therefore I think that this external evaluation on health sector will also contribute to our preparedness for both normal situations and crisis situations.
Health security preparedness is carried out across sectors, including human and animal health, food safety, chemical and radiation safety and security. The division of labour and flow of information between the various authorities must be pre-agreed and operational in order to prevent, detect and respond to unexpected health threats effectively.
Joint external evaluation process has been developed to enhance and help the implementation of WHO's international health regulations. Health security at the country level and at the global level needs networking with multiple sectors and multiple different global processes. In Finland, during our own JEE, we decided to do teamwork. We collected relevant ministers, and they were responsible of planning the process. That is how the different ministries really get the ownership for this process.
The JEE process, with its multi-sectoral approach, includes the concept of One Health, a holistic approach that aims at addressing health threats in the human-animal environment interface.
The problems today are so complicated when we are talking about the health of us human beings. For instance, the increasing antimicrobial resistance, which is an issue everywhere in the world. So the solution is the One Health approach. We have to combine the expertise between the healthcare experts, animal health and environmental protection knowledge. That's the only way how we can solve the wicked, complicated problems and take good care of our children today and in the future, everywhere.
The external evaluation is preceded by a comprehensive self-evaluation, the results of which are presented to the International External Evaluation Group. In Finland, a large group of different authorities participated in the self-evaluation work for months. At the end of the evaluation, the international expert team gave specific recommendations for measures by which authorities can further develop health security. On the basis of the recommendations, the various authorities will draw up a multi-sectoral national action plan. The JEE supports countries in the implementation of the international health regulations approved by 196 countries.
Joint external evaluation is one of the components of IHR monitoring and evaluation framework, and this is a voluntary process where the country requests for the external evaluation and WHO coordinate and mobilize the experts and resources for a country to conduct the evaluation, and this is done to evaluate the country's capacity to prevent, detect and respond to any event.
The JEE process begins as a country volunteers for the JEE and the WHO establishes communication with the host country. The host country conducts a self-evaluation before the external evaluation. During the external evaluation, scores for 19 technical areas described in the JEE tool, as well as priority actions, are developed to enhance health security based on interactive sessions with the external team and host country representatives.
One of the technical areas covered biosafety and biosecurity. In Finland, we do have a very long tradition in working together. There were 12 of us up front representing 6 different organizations. And this describes the way things are done in Finland.
The JEE is not an audit or inspection, but a collaborative process based on openness and transparency. The external evaluation team comprises international experts from different countries and organizations across sectors. Each team is led by experienced team leads.
I think the whole point of putting these teams together, and WHO does that in a very good way, is to get very much of a multi-sectorial team. And I think we have a very good selection of those kind of people in the team. We have people from the veterinary side, we have people from the security side, we have a number of public health people, we have some medical people, we have some communication people. So we cover a very wide spectrum of different specialities, different backgrounds, and also extensive experience in working in different settings. One of the reasons is because Finland was one of the countries that really started up this process, and I think it developed into a very important tool for increasing the health security in the world, both by that we now know better what countries can do and cannot do, but also that we form a number of very successful and very important networks among experts in different countries.
The cooperation is very important, and of course the multisectorality.
The security authorities, including those responsible for the transport sector and customs and border control at the points of entry, play a key role in ensuring health security. Working across sectors helps to point out countries' entire needs related to health security, not just the requirements of the individual sector. The team of contacts, consisting of experts from many different administrative sectors, has been a successful solution for Finland.
What is the point of contact here in Finland? It's not actually one person, it's a team. There has been extensive communication and collaboration.
After the evaluation, the host country is given the opportunity to review the report developed by the external team. Finally, it is posted on the WHO website. The JEE is only the beginning of the process in enhancing national and global health security. In some countries, a separate national action plan is developed. In Finland, the recommendations of the evaluation are carefully studied and followed through in the development of the national action plan. This will be integrated into the comprehensive security strategy for society and, as necessary, within new legislation and in other policies.